Greetings. Hi, I'm Judy. Welcome to Sun River Chambers Lunch at Home and Learn or Zoom and Learn. Really glad you're here. And for my local friends, I hope that you made it okay through that massive windstorm yesterday. Wow. I know a lot of trees are probably down, so luckily it's a beautiful day again today, right? So every Tuesday we have an interesting talk about stress relief, which we need, um, and or health related. And you can get the link to join us on the Sun River Chambers newsletter. Ask to sign up for that. Or every Monday, Kent puts it out. Or the Facebook page they have. Or at my site. And there's the link. Today, I wanted to share with you really amazing self-help tools that we have available to us just because we have bodies. We have these acupressure points on our bodies that sometimes get stuck. The energy flow gets stuck, and we can get relief just by pressing on them without even having to go to an acupuncturist. So this is an example of a map of our energy lines on our bodies, and they're color coded because a little bit like a train station, right? Different lines go to different organs in this case. And the reason they're color coded is because, amazingly, these colors that are connected to the heart, not surprisingly, the healing color is red. Or the lung and the large intestine, for example, it's not gray actually, it's white. That's the healing color. And they're on the same line, the lung and the large intestine. So it's a little bit, counterintuitive as to what might be on the same line, but it's magical. It's really a beautiful design that we have in our bodies. I thought you might be interested in the origin of acupuncture, and acu is the Latin word for sharp. So back in the old days, the ancient Chinese military doctors kept really good records of the soldiers they sent out into the field. And this is just an example, I made it up, but what looks like a peanut there on the drawing is actually a stomach with an ulcer. So say, for example, the guys that went out that had ulcers and were, I'm making this up again, were shot with an arrow in the right knee. And if they survived, the doctors found that often being shot in that particular place after they healed, their ulcers also healed. So they kept this intricate record keeping and discovered that putting needles into these certain points that are specific for certain organs can help heal the body. So it's pretty incredible. And here's a quite beautiful slide, I think, of the different organ systems and the initials that the Chinese acupuncturists use, if of course they're using English letters. So you know when you see LU, that means the lung, large intestine, LI, etc. And again, the lung and the large intestine are on the same energy line, and their healing color is white. The stomach and the spleen are actually anatomically close together, and they're golden colors, yellowish colors that bring healing to those organs. The heart and the small intestine are on the same line, so they have a lot of the same hue of color, red and pink, and the same with the bladder and the kidney. So if you see GB, you'll know it's gallbladder. LV, you know it's on the liver line. And here's the book. I swear I've had this book for 35 years or something. It's absolutely falling apart. I need a new copy, and there are new copies. And I've drawn the pictures and the organs and the healing of different issues from this book. It's from the Berkeley Institute of Acupressure. So just to review from some traditional Chinese medicine or TCM or Qigong, which I also teach, often pain is a result of our energy flow getting blocked. And it tends to get blocked at certain little points along the line, like a train station, if you will. And these little mini energy centers can be massaged or pressed on. And if you find points on your body that are sore, that actually does mean that they're blocked up a bit, and you can press on them gently and find some relief. And it may not happen in 3 seconds like we Americans like to have our relief. So it could take a few minutes or half an hour and just kind of come back to it later, that kind of thing. It's a more natural method of healing. So massage or pressure or tapping, we've talked about tapping, can pulse the energy through too, but that specifically, if you didn't know about acupuncture and you didn't know about tapping, you would just press on it, those points. And my Qigong master calls that qi-sage. It's kind of cool. The other tip I could give you is in Qigong, we use a lot of our mental power, our focus, our intention to heal. So you might say to yourself while you're pressing on a point, this qi channel opens up, or my qi channel, if you happen to know it's on the lung line, like out here, lung 1, you could say, my lung channel is open. My lung channel is wide open while you're pressing or massaging. My pain dissolves. There's so much research now that shows that our bodies follow our mind and our mindset. And again, it could take, a bit of time, a few practice periods over a day or a few days. Often people get relief. So let's talk about low back pain. And B again stands for bladder. So the 2 points on either side of the spine at the waistline are bladder 47. And then on either side of the sacrum or the low back or high up into the butt muscle, if you reach back in there and press with your thumbs or however, turn your hands this way and use your middle fingers, just pressing and massaging can bring some relief. B54, these are all the bladder meridian behind each knee, so there's 1 point on either side often. Pressing into the back of the knee, you can reach that. Now, you may ask, how the heck do I get back there if I'm on my own? And there is a very cool thing, plastic hook thing called the S-hook. And you notice it's bigger at one end with a bigger ball and smaller at the other end. And this is a handy tool that you reach back behind you. Say I wanted to reach my shoulder blade, I can just pull against it or lean into it and gently rotate that a little bit. And you can also reach around to your side, and it's just a super thing. I love it. It has a disconnect in the middle, a button, so you can put it in your suitcase or your backpack or whatever, take it with you. And it's really, really handy. And ideally, you could find somebody to help you give you a massage. So let's go back to the low back pain and notice that, again, on either side of the outside of the knee is the gallbladder 34 button or point. And it's in front of the bigger bone in your lower leg, the tibia, but on the side of your kneecap. And here's the thing that I've learned. I thought, if you went to an acupuncturist, they obviously know exactly where to put the needle. And people have asked me, well, if I'm just trying to find it on my own, how do I find it? And what I would say is you've got an inch or an inch and a half leeway around these points, and you'll still get relief. So the other tip again to remember is that if you feel some achiness or soreness, that's stuck energy. You just gently press into it. You have to be the best judge. If it's too much for you, you might go see an acupuncturist or an acupressurist. But if it's not too bad, then you can do a lot on your own. So on the side of the knee is good for low back pain. And then underneath the ankle bone, there's kind of a divot in there. You just gently massage there as well. And then you alternate sides, right? So try on one side and then on the other. You could do it while you're watching TV. But, you know, when you do watch TV, you tend to not focus as much. So give yourself the luxury of a few minutes of nice, kind massage. Now here's sciatica. And you'll notice the bladder 47 points were mentioned in the last slide for low back pain. So a lot of these points are duplicates. And you might find, let's see if I can find this just as an example. B48 is on page 47. No, excuse me, 17. So if I look up B48, 48, sorry. The benefits are not just around sciatica, but also pelvic tension, bladder weakness, hip pain, urinary problems, prostate problems, lower back aches, menstrual cramps, and frustration. So this is kind of the Chinese way. They have done such a detailed record keeping that they know exactly all the different issues related to certain points. But I pulled out all the points that are connected to sciatica. So using your S hook, you could get back to the top of the glute max muscle in there, gentle massage. Again, the same, look at that, B54 behind the knees again. And then if you look at the side of the body and feeling on the outside of your hip, this may take some searching to find. So perhaps both fingers at the same, both thumbs at the same time or one at a time, just reaching approximately into the gallbladder 29 area and some pressure. Again, you could find a friend to help you out. That'd be even better. And on the outside of the thigh along the IT band, iliotibial band, often pressing right in there can give some relief. And my menu is covering the next, area, but it's the point, say this is my foot. So here's my fourth toe, here's my fifth toe. I'd be pressing deep into the area between the two metatarsals there. So pressing in there, which could be easily done if you were to lean over with your torso on your thighs and just kind of massage those points again between the toes. Moving along to knee pain, the same point, the gallbladder 34, top of the tibia and outside of the knee. Both sides, outside of the knee, could give you relief for knee pain as well. That's so intriguing. And then on the inside of the knee, both sides, is spleen number 9. And I would maybe cross my knee over my other knee, my ankle over my knee perhaps, or just lean over and find the point that's behind your tibia, between the tibia and the fibula. And again, you can guess. You've got some leeway there, and just gently massage, press in, and give yourself that time. Another set of challenges we might have would be digestive or abdominal disorders. What's fascinating to me are these beautiful names that the Chinese doctors have given to these different points as well. For example, B42, bladder 42, is called the soul door. And if you look, I don't know if my mouse is going to show you, but the triangular muscle from the neck on either side of either shoulder coming down to the mid back, there's this beautiful triangular muscle called the trapezius. And then below that, between the mid back and the waistline, coming off in an upward direction, is the latissimus dorsi muscle. Beautiful. When you look at the musculature of the body, it's just artwork, really. And in Latin, latissimus is the widest, means the widest, and dorsi is the back. So this is the widest muscle of the back. And I'm really glad I took Latin because that's really helpful. Anyway, B42 is bottom of the shoulder blade approximately, or if you can imagine getting between those two muscles, you'd probably feel a bit of soreness, and then you know you're in the right place. And if you want some vitality, get those waistline spots again on the bladder line. That's called the Sea of Vitality. On the front of the body, the two main channels, meridian channels, are the conception vessel, which runs from the top of the head in the direction going down toward the base of the torso, and the governing, which is female energy, yin energy, and coming up the back from the base of the torso, up the back is the governing vessel, the male energy. And when those two channels are flowing well, they flow into the rest of the other smaller meridians. And so it's a good idea to, when you're meditating, to imagine breathing your breath up your spine to the top of your head, and then exhaling down the front. And that will help stimulate those two main channels. So conception vessel number 12 is right over the solar plexus. And it's not, if you can feel the bottom of your ribs, it's not that far down on the midline, it's sort of up a bit. It's called the center of power. And if you find that spot along your midline, and you would want to do it on an empty stomach, right? So pressing in, but also up, will give you some digestive relief. It's also another, these points are multi-purpose, so it also can relieve stress. And it's an easy one to get to. Any questions at any time, just feel free to join in the chat room. So headache. These are some awesome points. Let's start on the left side and just notice that the gallbladder 41 between the two metatarsals on the outside of the foot, 4th and 5th, amazingly could relieve whatever it was before, some kind of back pain, knee pain, and headache. So more bang for your buck. And then the 2 points that we use in tapping as well, over the mid of your eyebrow. Actually, we use the inner eyebrow, but these are just above the middle of your eyebrow, gallbladder 14. Gently massaging in there can relieve a headache. Pressing, seeing if you can also relax your neck, because you are applying pressure to your head, so you'll feel yourself push against it. So you don't have to press that hard. Even just a little tapping or a massage will serve the purpose. The other place, I can't remember if this comes from yoga or probably Qisage from my Qigong master, but if you grab the flesh between your eyebrows and just squeeze, that can help relieve a headache as well. So just squeezing there and imagining letting the stress go, letting your anxiety or whatever's given you a headache go. Excellent. question. Do you need the tool to reach the back pressure points for digestion? Yeah, you kind of do. Well, actually, some of them, I don't know if I can reach the mid-upper back, but the waistline ones I could reach. And I don't think they're very expensive. They're like $20 or something on Amazon. I got mine several years ago, so I can't remember, but they're not very expensive, and Amazon's a few days away. Thanks for the question. So these points, now gallbladder 20, you'll have to feel, I use often my thumbs and press in like this, the bottom of my skull, press in and massage. I had a headache the other day. I was starting to do some fasting, and I was going off alcohol and off caffeine for a week ahead of time, and I still got a headache. So it does do some detoxing at the same time. And I found I got some relief by pressing on gallbladder 20. And it's not right at the center of the base of your skull. It's more on the outside where your skull kind of dips down a bit like that. So you'll find it just by knowing that it's a bit sore. And then at the very top of your spine, bladder 10, C1 and C2. So you're at the top of cervical 1 and just pressing in. You can use your middle fingers by pushing up like so, or your thumbs, and just give a nice deep press in there. Massage and press, and deep breaths. My bladder, now I'm on the B10, so I'll say my bladder channel is open. My pain dissolves, or something similar that's in present time relief mode, if you will. Not, I'd like it to go one day, or I hate this pain, I want to, get rid of it. We want positive present time phraseology. That's what the body responds to. And then gallbladder 21 is just approximately at the outside of my shirt here, just pressing down. Now, if you know anybody that's pregnant, I would suggest actually not doing this, because they say press lightly, but I wouldn't want to take that chance. So a couple of places that are not good to do when one is pregnant is this one here. But if you're not, you can actually get some good relief. It's the base of the sternocleidomastoid muscle from the, back here down to here that gets tight. Both sides, one and then the other, or both at the same time. And by the way, another one that you don't want to do when you're pregnant is the hegu point, which is in the fleshy part between your forefinger and thumb. And that can get really tight for a lot of us. So you want to start slowly and gently, and do not do it if you know your friend is pregnant. It must obviously affect the fetus. So both sides. It's a really good one. You can do it while you're sitting at a conference room, just massaging your hand, and nobody would know. It's very cool, isn't it? I love acupressure. Insomnia. Let's start on the left with kidney 6, which is also called joyful sleep. Pretty cool. You're just massaging underneath the ankle bone, pretty much. Gentle massage before you go off to bed. Or you could be in bed on your side and lift your knees and get this point if you wake up in the middle of the night and you want some relief. And again, both sides, inside underneath the ankle bone, or on the outside underneath the ankle bone. Bladder 62 is called calm sleep. I don't know if you can choose if you'd rather have calm or joyful, or heck, go for both. Going to the middle diagram on the front. Stomach 16 is an interesting area, because in tapping 2, I've worked with people, more women than men, get kind of blocked up right here. You can massage like this or massage into those points kind of between the ribs, and you'll feel your ribs in there. It's you're massaging the tendons between the ribs. Deep breaths. So that's good for sleep, and you can do one side when you're trying to sleep, just with one hand. Also, spleen 16, stomach 16 and spleen 16. As your rib cage drops down, but not toward the very bottom, but right here's the bottom of my rib cage down here. So we're talking about midway pressing, but you can feel the edge of your ribs right there. That's where you want to press in. And again, what will guide you is how sore it feels and where it feels sore. Okay, so pericardium 6 is between the ulna, this bone, and the radius. And you go straight in here. Here's the crease of the end of my hand to the beginning of the forearm. It's an inch or so in that divot. I don't know if you can see it. If I press in, you can see between the bones there. This is good for getting some sleep. It's also good for panic. If you ever feel more than anxious, in panic mode, I believe it's also where they have that strap for seasickness. So again, a lot of good results from pressing on this point. Feeling the tension just melt away, and tending for the tension to melt away. Both your heart and lung meridians run through your arms, so it can help, calm your heart down. We did we do gallbladder 20 behind? Yes, we already did that. So same for headache and insomnia, massaging outside of the base of the skull on either side. And then you're going to need your S-hook to get into bladder 38. It's just on the inner edge of the scapula, the shoulder blade toward the spine. And boy, I have had a knot in that place for a long time. It wants to come and go, and I think it's more related to my posture being off a bit. When I forget to use my heel lift, my body wants to grab on and hold me up there. So I like to massage that place frequently. Respiratory problems. We just saw B38 for, go back, look on the right, for insomnia. So you will get good relief for more ease with breathing in that point as well. And I thought you might like to know that they call that point the vitals diaphragm. That's pretty cool. So underneath the scapula, and before you get to your humerus bone, if you just press into a divot there, that is the first point on the lung meridian. It can really help to relax our breathing, and asthma as well, I understand. So pressing there, lying down or sitting up, will give you some relief too. So that's pretty cool. Now I did a close-up here of the 2 points on the inner wrist. And this gal is standing with her palms facing forward, though it's a little hard to tell, but that is how she's standing. So that means that if I come into that same place and turn my palm out, a little hard to see, but the bone that's closest to me, or to you actually, starts with a U. It's called the ulna, and the bone going down the outside is the radius. So I tried to make a little drawing here of the 2 places. You already saw pericardium 6. It's right between the ulna and the radius. And I get that it's a little hard to tell because there are no indications of bone and white and bone. But if you come now to the inside of your wrist and press in here, you're going on the outside of the radius, right there. Somewhere in there, if it's blocked, you'll feel a little bit of soreness. That's lung number 7, and that can help us breathe more easily, obviously, on both sides again, too. Just massaging and doing your best to breathe will give you some relief. It's just amazing. This whole system blows me away. Now, here's a challenge I had for many, many years. I used tapping to help me get beyond why I needed sugar. Certainly it was an old familial pattern. I have English and Irish and Scottish heritage, and everybody had a cup of tea at 4 o'clock and a big sugary thing. So I followed that pattern. But I also it was an addiction in a major way. This point on the inside of each knee, the spleen 10, the spleen and the pancreas are closely related in Western or Eastern medicine, so it's fascinating that it would be on the spleen line because, well, the pancreas, deals with sugar functionality, and just pressing on the inside there. If you have a sugar craving and you remember to do this, might serve you well if you want to get beyond having sugar cravings. And again, saying my spleen channel is wide open. My sugar cravings decrease. And if you can even wait 5 minutes before you go for that candy bar, you start to build some emotional strength and a new mindset. And that's what I found helped me a lot. So those were the points I wanted to share with you today, and there are many, many more. I found a website done by UCLA, and it's fascinating that they now have, websites at big universities that talk about Eastern medicine, but the name, you could take a picture of this, that might help you, or I'll help me remember to put this link into the Facebook chamber page comment section. Explore IM, which stands for Integrative Medicine. So how cool is that? And there are lots more. All you have to do is look up online acupressure points, and you'll see everything from old Chinese books and, people that I would just be careful. Just look for a reliable source. If it's a TCM, traditional Chinese medical source, or university like UCLA, you'll probably be in good shape. And if you don't get relief, obviously you need to go see somebody that can give you other technologies, physical therapy, surgery, maybe, hopefully not. But if you can remember to do acupressure, it may well serve you to get some pain relief. Sometimes that's all it is blocked qi. Thank you for joining me. And next week, I'm going to be showing a video by a neurosurgeon who got tired of doing so many back surgeries that he started to develop different kinds of chairs for us to sit on, because he found, as more and more people are finding, sitting in one place for too long, hours on end, is just not good for us. That's why they've developed those standing desks and so forth. It's a great video. I can't wait to show it to you, and look forward to seeing you then. Thanks for joining me. Bye-bye.